Assalamualaikum warahmatullahi wabarakatuh. Today, I'm going to be introducing a cervical and thoracic spine routine, which is AP open mouth. It is pathologically used to demonstrate any fracture on the C1 atlas or the C2 axial or any adjacent soft tissue structure. But we as a radiographer must be very careful to never remove their cervical collar or move the patient heads or neck unless with the approval of the physician in charge.
In order to do AP open mouth projection, the first thing that we need to do is the patient positioning. First, patient must be in supine positions. Next, we must center the MSP of body to the midline of IR. Aligning the MSP to the IR is important for producing high quality and accurate radiographs that are crucial for effective diagnosis and treatment planning. And last but not least, we must make sure patient's arms along the side of trunk and both shoulders must lie in the same horizontal plane. Proper patient positioning in the X-ray process is crucial for obtaining clear and accurate image, minimize the radiation exposure, ensure the patient comfort, and prevent the needs for repeat examinations.
Next, for the part positioning, first, we need to straighten the patient's head without opening their mouth. The beating surface of the upper incisor, which joining the lips, must be aligned with the base of the skull, which is the mastoid tips. Second, center the central ray to the image receptor. Next, ask patient to open their mouth without moving their head. And lastly, ask patient to keep opening their mouth and softly say "ah" during the exposure. This is to ensure the tongue stay at the floor of the mouth so that it doesn't interrupt the region of interest.
So, for the central ray of this projection, firstly, you need to make sure that the central ray pass through the center of open mouth, and also make sure image receptor is aligned to central ray, and also central ray is perpendicular to image receptor.
This is the radiographic image appearance for AP open mouth projection.
First of all, AP projection of the atlas and axis are through the open mouth. Contrast and density of the image are adequate to demonstrate the bony structure of the atlas and axis. Then, penetration is sufficient to visualize the bony trabecular patterns and cortical outlines of the atlas lateral masses, transverse processes, the axis, then spinous process, and the body. Atlas and axis demonstrate a true AP projection. Atlas is symmetrically seated on the axis with the atlas lateral masses at equal distance from the dens. Spinous process of the axis is aligned with the midline of the axis body, and mandibular rami are demonstrated at equal distance from the lateral masses. Upper incisors and posterior occiput inferior edge are demonstrated superior to the dens and the atlantoaxial joint. Dens is centered within the collimated field. Atlantoaxial and atlanto-occipital joints, the atlas lateral masses, transverse process, the axis, dens, and body are included within the field. Finally, the shadow of the tongue is not projected over the atlas and axis.